Do you know that during a C-section, doctors don't cut through every layer of muscle like many people believe? Hi everyone, welcome back to my channel. I'm Dr. Cesarean, and today we're going to talk about one of the most common surgical procedures in the world, the Cesarean section, also known as a C-section. Many people think a C-section is simply taking the baby out through the abdomen, but there's much more to it than that. A C-section is a surgical procedure used to deliver a baby through incision made in mother's abdomen and uterus. Your doctor may recommend a C-section for many reasons. For example, if the baby is in a breech position, if labor isn't progressing, if the baby shows sign of the distress, if the placenta is covering the cervix, or if there are certain medical conditions that make a vaginal birth unsafe. Before the surgery begins, the mother usually receives spinal or epidural anesthesia. This allows her to stay awake during the birth while the lower half of her body becomes numb, so she won't feel pain during the operation. After the anesthesia starts working, the surgical team cleans the abdomen with antiseptic solution and covers with sterile drapes. The doctor then makes a small horizontal incision just above the pelvic hairline. This type of incision usually heals well and often leaves a less noticeable scar. One common myth is that doctors cut through all of the abdominal muscles. In reality, they carefully separate many of the muscle layers instead of cutting through them whenever possible. This helps reduce tissue damage and may improve recovery. After reaching the uterus, another incision is made and the baby is gently delivered. Once the baby is born, the umbilical cord is clamped and cut, and then the placenta is removed. Finally, the uterus and the abdominal layers are carefully closed with stitches. In most cases, the entire procedure takes about 30 to 60 minutes, although the baby is usually delivered within the first few minutes after the surgery begins. Like any operation, a C-section has both benefits and risks. While it can be a life-saving procedure for both of the mother and the baby, recovery is generally longer than after a vaginal birth. And there is a higher risk of infection, bleeding, blood clots, and complications in future pregnancies. That's why the decision to have a C-section should always be made together with your healthcare provider based on your individual situation. Thank you so much for watching. If you found this video helpful, don't forget to subscribe, like, and leave your question in the comments. I'll see you in the next video. Take care. Goodbye.